Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Rema Muslim, and today I'm going to talk about our research. I'm a medical laboratory specialist, graduated from King Abdulaziz University. And our research is reticulocyte hemoglobin equivalent potentially detects, diagnoses, and discriminates between stages of iron deficiency with high sensitivity and specificity. First of all, I'm going to talk to give a brief background, and then I'll talk about the methodology used and the results obtained, and after that I will conclude. First of all, anemia is a global health problem that affects approximately 2 billion individuals worldwide. And especially in Saudi Arabia, iron deficiency anemia is a common health problem, especially among children and women of childbearing age. So as we all know, that reticulocyte hemoglobin has a lifespan of about 3 to 4 days, as it spends 1 to 2 days in the bone marrow and enters the bloodstream to complete its life cycle. Also, reticulocyte hemoglobin reflects the iron readily available for erythropoiesis. So our study aimed to investigate whether reticulocyte hemoglobin could be used as a potential marker for diagnosing iron deficiency, anemia, and monitoring the iron therapy response relatively quickly compared to other hematological and iron biomarkers. First of all, we have recruited participants depending on questionnaire that had been shared. And after we obtained the results, we have excluded some of the participants. We have excluded pregnant women and participants who were taking iron supplementation and who had blood transfusion in the last 3 months. Also, we have excluded who suffered from hemoglobinopathies or malignancies. So the total of the participants were 182 participants. We have collected a set of tubes. The first tube was a plain tube to measure iron and total iron binding capacity and ferritin. The second tube was used as ADTA tube to measure hemoglobin and reticulocytes, and also reticulocytes hemoglobin. And after we obtained the results, we have divided the participants into 4 groups, depending on hemoglobin level and reticulocyte hemoglobin, depending on ferritin and hemoglobin level. The first group was ferritin, was a control group, and it had a normal ferritin and hemoglobin levels. The second group was iron deficiency anemia group, and it only had low serum ferritin levels. Thirdly, iron deficiency anemia group, and it has low serum ferritin and low hemoglobin level. Finally, anemia without iron deficiency group. After that, we have administered 190 milligrams of ferrous sulfate, and another set of samples was drawn on the 7th day for follow-up. And the ferrous sulfate was administered for only iron deficiency group and iron deficiency anemia group. And for the statistical analysis, GraphPad Prism was used, and the significant level was set at a p-value of less than 0.05. So now I'll talk about the results obtained. First of all, we have used Spearman's correlation to correlate between reticulocyte hemoglobin and, to correlate between reticulocyte hemoglobin with serum ferritin. So as shown here, the x-axis represents ferritin, and the y-axis represents reticulocyte hemoglobin. And each dot plotted here represents a single patient. As shown in the graph, we have obtained a p-value and an r-value positively correlated. So we can say that it is a valuable marker. So we can see that the reticulocyte hemoglobin is a variable marker and correlated with serum ferritin. Secondly, we have used ROC analysis to compare and to validate the reticulocyte hemoglobin as an efficient marker in diagnosing iron deficiency and iron deficiency anemia. And as you can see in graph A and B, the area under the curve was almost 0.94 to 0.99. And as known that the area under the curve, if it was almost 1, it indicates a high sensitivity and specificity as well. And it's considered as an excellent marker. So in graph A, we have calculated the cutoff value where it was greater than 21. So it gives a sensitivity of 90% and specificity of 92%. While in diagnosing iron deficiency anemia in graph B, we can say that the cutoff value were greater than 28, and the sensitivity specificity was high, as it was 92 and 97 approximately. So we can say that receiver operating characteristic is a potential marker in diagnosing iron deficiency anemia and iron deficiency. Finally, we have compared reticulocyte hemoglobin, and we have compared it between hemoglobin and reticulocyte hemoglobin. And we have see a result that is sensitive for iron treatment. As I said previously, that in the first graph, we have obtained a sample, and secondly, on the 7th day, we have obtained another set of samples to determine whether it is reflective in iron therapy or not. As you see in the graph A, the first patients, there's no response on the 7th day after the iron supplementation with hemoglobin. But on the other hand, the graph B, iron supplementation showed a significant result using on the 7th day of obtaining the sample. So this, we can say that reticulocyte hemoglobin is a sensitive marker for iron treatment, and it is...
1 minute. Yeah. Okay.
Yes. I'm sorry. And reticulocyte hemoglobin is a potential marker for detecting and diagnosing different stages of iron deficiency with high validity. And reticulocyte hemoglobin is a very sensitive and effective marker, as it outperformed hemoglobin in reflecting the bone marrow response to iron therapy within a short period of time. As if we can conclude that the iron therapy response within a week using reticulocyte hemoglobin gives a better result, while on the other hand, using hemoglobin didn't show any effect. So I would like to thank King Fahd Medical Research Center and King Abdulaziz University Hospital for our research. And we have, me and my colleagues have done this research, Amir Al-Jahani, Ragad Al-Jabri, Sarah Baoud, and it was supervised by Dr. Majid Al-Mushdari. So
Thank
these
you, sir.
are the references. Thank you for listening.
Thank you.